Okay, morning everyone. Thanks very much for inviting us to come and talk to you today. We're going to talk to you a little bit about the UK coronavirus dashboard. Hopefully you'll have heard of it. Just a couple of disclaimers. So the first one is when we developed this, we were in Public Health England. That organisation no longer exists, so neither of us work for that anymore. I'm now in the Department of Health and Social Care, but I'm speaking on my own behalf here, the lessons that I've learned, and Pouria can introduce himself when he comes up. So, what we'll do in our talk, we've given this a few times, we've tried to pivot it a bit for this to lessons learned. So we'll talk a bit about where we think we are now and how we got here. So how did we get to where we are now? So these are some examples of the developments that we made on the dashboard when we started. So Pouria joined the project in March 2020, I think, when some senior managers said, we need a dashboard. Lots of countries have got dashboards, we haven't got one, let's get on with it and do one. The very first version isn't here, that was an ArcGIS. Very quickly spun up a map and some figures. The first version that was going when I said I would get involved is the one on the bottom. That was spun up in April 2020. The middle one was July 2020, something like that. And then the more familiar one that is very similar to how it kind of looks now, that was launched in October 2020. So fairly rapid kind of development of presentation. Alongside releasing the data every day at 4 o'clock. So where were we when we were doing this at the peak? So we had up to around 1.5 million daily users at 4 o'clock hitting F5 and causing Pouria a lot of stress when it may or may not work. And the more you hit F5, the less likely you are to get the data. So something to bear in mind. It's about 200,000 people at peak time hammering that every day. And at that time, it was the most used government service. Not just for data, just at all. So, supposing you were put in the position of having to spin up a dashboard for something, what have we learned that would be useful for you? So one of the things is it really matters how you present your data. It can give different conclusions depending on how you think you're saying something that basically is the same. So this was for vaccinations, which we introduced in January 2021. I think actually the first vaccination data we got up on the site 2 weeks after the first vaccination was given. And we had a lot of discussions about how we should say this, and there's just some examples there, and eventually landed on what's listed there. Accessibility, so absolutely essential to build accessibility in from the start of any development. I've seen quite a few presentations of dashboards and things here, all looks great. But in my head, it's going, is that accessible? And we're really lucky in the UK. We've got the government digital service. They have loads of great guidance on how to make your service accessible. And, you know, I'm not saying we were perfect. We definitely weren't. And it was, as it says here, it's always a work in progress. But absolutely consider that from the start. And it also goes beyond the website. So here's what you would get if you search for COVID in the UK on Google. And they drew this data directly from our API. So just a little bit on user-centered design. Very beloved of GDS, and quite rightly. So user testing, really, really important, but is it always about what your main user, your chief exec or whoever is it, about what they like? Well, maybe. So here, initially, loads of people really like the top one there. 60% of people we tested this with really like the double bar, great. And only 30% preferred the waffle chart. But what we then did was get people to read the charts and tell us what percentage of the population have been vaccinated. And actually, the one that allows you to see that from the picture is the middle one, the waffle chart. And that's the one we went for in the end. Open data, this is absolutely crucial. So we really wanted to make sure that everything that we'd built the dashboard on was available to the public. So that's great, obviously. However, there are some downsides to this. So as I said earlier, we had 100 to 200,000 people hitting F5, getting that data. And you know, sometimes we got it wrong. Unfortunately, if we did, then sometimes that was broadcast on national television within 2 minutes of us making the mistake. So it is just worth bearing in mind the impact of some of this stuff. However, that's also incredibly useful because within 2 minutes, people have said, that doesn't look right. What's going on? And that actually then helps us fix the problem, work out why it's happened, and stop that from happening in the future. You know, and a minority of people would be just trying to catch us out, I guess, saying, well, you're the government, you're useless, you don't have a clue what you're doing, or just to justify some unfounded theory that they have. I think the way we look at this is both of those types of people are users of the data. They make points that have a right to be heard. It's just the way they go about it is different. And for us, the second group actually are just as helpful as the first in helping us do user research, improve our SOPs, as I say, improve QA, design, and help us achieve inner peace. So I mentioned the API, absolutely crucial, and here's a nice quote from the Office for Statistics Regulation, who we absolutely love, and they liked us as well, so that was nice, and they really liked the API. But the dashboard was really pretty, yay, and Bloomberg thought so, and they wrote a nice article about it, but they got some of the stats they presented wrong. So my question to you is really, are we at risk of learning the wrong lessons on all of this? Are we at risk of learning that we need a pretty dashboard? Lots of you have probably heard a senior manager say, I need a dashboard on that. Or a minister says, well, you've got the COVID dashboard, I want a dashboard for my thing. Whereas I think what I want to say is, you can have a pretty dashboard, that's great, but if you don't sort out your data infrastructure that's underneath it, it will be almost impossible to maintain that dashboard and make it worthwhile. So I will hand over to Pouria now for the rest of the talk.
Hi, good morning. Right, so, yeah, are we at risk of learning the wrong lessons? Before I start, I'm just going to add to the disclaimer that Claire presented that I'm no longer a civil servant, so I can say things that she can't without destroying careers. Yeah. So, yes, it turns out we are. You know, Bloomberg thought it was very pretty. It was very pretty, to be honest. I mean, I really liked it, and we had a lot of fights over how to present things, so I'm sure they worked. But the issue is that that is our objective to satisfy Bloomberg, isn't it? Or to not appear with a negative headline, on the front page of the Daily Mail. So that seems to be the goal right now, not to have something that actually works and is durable. Designing a national service, designing a new infrastructure that costs a lot of taxpayer money also requires forethought. And by that I don't mean spending 2 years working on user research on how things look, rather than, creating a resilient, a durable, a maintainable infrastructure that can be extensible, that can accommodate future needs, and is powerful enough, yet versatile enough, that we could easily add to it. It's properly documented. It has, with respect to data, it has proper metadata. It has history of changes associated with each metric. That is not part of the user research. Why is it not? There's a very good reason, because you don't quite foresee that. You can't possibly know everything when you're starting, and no amount of user research would give you that in the context of the new work that you're trying to do. So you need to stop talking at some point and start doing, and then incrementally improve things. We think in government we're doing things in agile. You're not. Let me have news for you. We're not. That's not agile. If you are releasing things in bunches, that's not agile. That's not incremental improvement, that's versioned, which means you're doing waterfall. That's not agile. So, let's move forward. So service-driven design is not a one-off process. I have it as an example. I'm sure you can see it. Yes. So at the bottom of this is interaction heat map with the front page of the dashboard. At the bottom of this, you can see a bunch of graphs. There are actually 4 of them in each card, where it says, positive, people tested positive and deaths and patients admitted. The bottom graphs, you could see that on the graphs there is an increased interaction, meaning that people are clicking on it or tapping on it on their phones. So why is that important? That wasn't a clickable entity. People were clicking on it, expecting something to happen, but it wasn't a clickable entity. And there is no way we could have foreseen this. There is a link underneath. You could see those are also very red. You could click on it and go to the relevant page. But that graph was just a thumbnail for all intents and purposes. Yet people were expecting something to happen. And they were expecting to either, zoom into it or go to a more detailed version of that graph. We found that, and we very simply added a hyperlink to that image, which took the person clicking on it to an interactive version of that graph, which in turn helped them, gain more details. But again, not something we would have been able to necessarily predict. Open data, I promise you, the slides looked a lot better when I designed them. This is not what this monstrosity is not mine. Yeah. But yes, there are complexities associated with open data as well. The pipeline that we designed had to process data coming from over 26 different sources, actually, later on. This is accurate as of 19th of May 2021. We reached 2930 sources by the end. 800 million raw figures. This is daily. 800 million new records coming in daily, some of which depended on other pieces of data coming in. So you couldn't produce one without the other. But we produced about 10 million figures in the end, which also, again, later on increased to 40 million. So that was a pipeline coming in. Then it went into ETL. ETL stands for extract, transform, load, which is basically data coming from the pipeline, from our sources, doing some calculations, and then going into the ETL, doing some additional calculations, and then putting it into our database, which would then be made available to our users. And the database itself, at that point in time, had about 3 billion records in it. Bear in mind that 3 billion records being made available to about 200,000 to 300,000 people using it per minute. and at its peak, we had about 80 million hits on the dashboard in a single day. 80 million, that's more than the population of the United Kingdom. So this is the 4 p.m. peak that you all loved. You can see that it's going within a 30-second period from about 20,000 to 300,000. That's enough to bring down any IT infrastructure. It didn't bring down this one. Why? Because a lot of planning had gone into it, but it also had resilient infrastructure. So how does one cope with this over and over and over again? This is a 30-day period. You can see at the bottom that, if you can't see, it says 1.35 billion hits in a month. Right? So it goes beyond the looks. You need to have a service that's beyond the aesthetics as well. This is the daily process, or an abstract of it. You can see there is a blue line in the middle. I usually call that the Chinese wall, and I'll tell you why. The pipeline started at around 8 a.m. Some of the people who worked on it are present in the audience. And it wouldn't have been possible without each and every one of the analysts who worked on this. This is started every day at 8 a.m. This includes Christmas Day, New Year's Day, every single weekend in 2 years that we worked on it, or I worked. So, yeah, it started there. We got pieces of data incrementally fed to the system throughout the day. Now imagine, if one of these was delayed, the whole thing would be delayed. And that's what we needed people to understand, and our comms was doing a terrible job of conveying it. Absolutely, they didn't know what they were talking about. Not at all. So ultimately, I decided, okay, I'm going to respond to some of these people on Twitter. Started doing that, and then I suddenly turned into a mini celebrity. Didn't sign up for that, but there you go. Now, what is that Chinese wall there? The Chinese wall is the part that separates the infrastructure that processes data, often anonymized or pseudonymized, but also individually identifiable data. I mean, we had data at individual level, so if it leaked, you could identify people very easily. The other part is the ETL. There was absolutely no way to get any data from the ETL side. You can't get data from the pipeline side. The data should have been pushed to the ETL side. And only data that was pushed to the ETL side was data that had already been processed and aggregated. So there was no possibility of leakage of any sort of identifiable data on that side. This happened in Public Health Wales. They had that type of incident during the pandemic. It didn't happen to us. It didn't happen not because we weren't unlucky like them. It didn't happen because we had designed a system that prevented that from happening in the first place. It was impossible for it to happen. Now, here, we have the pipe, that's supposed to say pipeline. Just take my word for it. Yeah, you see that green section in there? That green section is the SGSS data, England cases. That's just, this is an overview of our pipeline. So this is just England cases you're looking at. That's a process that needed to happen for England cases to be produced. And the only part that would go to the pipeline was that final red brick at the end of that line. That's what was feeding the data to the ETL part. And it was not possible for any other part of this to go there. Now, creating a pipeline requires you to have, data sources that are stable. So when I'm talking about having a maintainable infrastructure and having forethought and planning things, what I mean is that you need to have established sources. You can't start establishing sources in the middle of a pandemic. That's not going to work. Well, it worked for us, but we had to work 18-hour shifts for it to work. Initially, the source of data for Northern Ireland cases and deaths were the Twitter account of the Northern Irish Health Authority for us. So we were getting our data from their tweets because there was no established route for us to get the data. That should not have been the case. There should have been proper pipelines established, at least contacts established, so that we could reach out to them and get the data as and when needed. So this is giving you a view of how we process data and how much data needed to be processed by 4 p.m. Now, this process, on a good day, started at 3 p.m. Right, and it took about 30 to 40 minutes to run. I mean, each of these jobs needed to run. So we're talking about, I don't know, something like 30,000, 30,000 jobs that needed to run on a distributed system. And if one of them failed, you needed to find out why it failed, because there were safeguards in place to fail the pipeline in case some weird data happened to be there, like, you know, a case of COVID appearing in 1995 or something like that. Yeah. So, but if we were delayed, so if we didn't have cases data, which happened, well, not cases, but some other data, say, deaths data, until 3:30 in the afternoon, it would have been pretty difficult for us to release the data at 4 p.m. And that is why there were delays. Not very often, but there were delays. And then we had, never again am I going to send slides in anything other than PDF. Yeah, okay. So this was our management console. So you can see some of the data in each line of this. You can see that the tiny charts in there. It's giving you the time at which we received the data from the source. So you can see some of these lines show a red dot in the box plot, and that means that that piece of data was delayed on that specific day. So on this day, I don't know what day it is, but there were 4 pieces of data that were delayed, well, beyond their usual time. So yeah, we had to have the resilience to deal with something like that. And it wasn't necessarily very easy. So service design needs to be adaptive. You know, there are advantages and disadvantages to open data, some of which Claire hinted at. You know, one thing that I often mention, I mean, there are a bunch of things here that I'm sure you all know about, but there are double-edged swords as well. So the rapid identification of mistakes and the ever-growing demand for data because people just wanted more. United Kingdom had the most comprehensive national data on the coronavirus. We had the most number of metrics published anywhere in the world, over 230 metrics. We also had the most granular data. We had over something like, I would say, 8,000 areas within the United Kingdom. So most granular anywhere in the world, and people still wanted more. They always do. But it also comes at a cost because, you know, the rapid identification of mistakes means that if you make a mistake, the national broadcaster is going to publish it. So this is a case of them saying there were no deaths in the UK. Oh, there were deaths. There was a big yellow banner on the website telling you this piece of data is delayed. We just don't want to make you wait. So we're releasing the data and showing that as 0 pending an update. Nobody bothered to check that. They just said there were no deaths. So, okay, partially their fault, but it was also, there are things that we could do to improve that. So we created an API for them to get notified whenever there were delays or any notifications that they need to be aware of. And these are incremental changes that are necessary. And with respect to open data, we created very, very meticulously choreographed, if you like, set of APIs. And those helped people access the data the way they need it and with ease. So you could use this in your R or Python application if you wanted, or you could just download a piece of data and look at it in Excel. And it would generate, you would just select the metrics that you needed, it would generate a permanent URL for you for that piece of data, and you could just use it wherever you need it. And these things didn't come about by accident. I talked to a whole lot of people from different backgrounds to understand their needs and implement them in a way that was useful to them. And open data needs to be, you need to be perceptive when you're dealing with this. By design, we didn't provide any interpretation of data on the service, and that really helped. When you start showing interpretation of the data, people with the loudest voice win. Who has the loudest voice? The Secretary of State usually has the loudest voice. Or people who want to appease the Secretary of State who are above you get to have the loudest voice. Either way, it's not going to be helpful to the audience or the intended user. So you need to be very careful what you show, and you need to maintain the trust of people. And this is a study by the Royal Society showing very clearly that when policymakers or industry partners are involved, the trust drops. That's a very clear indication that you need to not involve these in the presentation of data. Yeah, not my word. Royal Society says they know what they're talking about. And we saw that. The moment we started interacting with people, the trust in the service increased. And these are routine surveys. The last one that you see is over 92% trust in the service. And that survey was responded to by about 36,000 people. So a fairly large pool of users. And that is, incremental increase has to do with us revealing our identity also on Twitter and trying to help people and all sorts of different users from different backgrounds. And we should always welcome collaboration in the sense, that open source comes with advantages. So we released all repositories associated with the dashboard as open source on GitHub. Anyone could look at it, anyone could contribute to it, and people did. Lots of contributions. I mean, the guy you see here on the left is the inventor of a programming language, which we actually used on the dashboard. So a lot of encouraging words and a lot of contributions. And we can't do it all on our own. I mean, David Spiegelhalter wrote a book using mostly the data that we produced, or based on that. And other people created very nice analysis. In the end, we also, yes, we are at risk of learning the wrong lessons, but also you need to think about establishing routes that you could then use when there is a crisis. It's very difficult to establish routes in the middle of a crisis. Now, here is something for you to think about. I'm not saying that, say, Scottish government doesn't want to do anything to make the Westminster government look good. I'm not saying that, but if I was saying that, what would you do about it? How would you address that? This is something to think about. And that's not just Scottish government, it's just all that. We also need to learn when to, kill things off. This project was great, but now it's just going on endlessly. A lot of people have moved on from it. There isn't much data to show. It's just past its good days. We need to stop things and start thinking about how to use what we learn and how to adopt what we have achieved in new project. And that's that. Thank you very much.
Thanks very much both to Pouria and Clare, much appreciated. And I think some really interesting lessons, and also I think some wistful, imagining that many people engaging with your data is a kind of incredible thing, isn't it? I'm afraid we probably don't have time to do questions, but hopefully you'll be around, so thank you very much.